All right, good evening. So this is
Good evening.
this is an interview conducting over your job with Dr. Ivan Terrero. He is a dentist, and we're going to see just
Hi.
everything we have to go for this interview.
Okay.
All right. So how long have you been practicing dentistry for?
I've been practicing dentistry since 1990.
So 25, almost 26 years.
Almost 26 years, yes.
What made you decide to become a dentist or work in that field particularly? Why not exactly a surgeon or a veterinarian?
Well, I was always interested in biology. I was interested in science. And when I was younger, I wasn't sure whether I wanted to be a policeman or a fireman. But when we started talking about biology in school, it interested me very much. And I liked animals. I had hamsters, gerbils, fish when I was younger, and they always interest me. And we had a dentist that we went to when I was young, and we switched dentists. And that dentist, the new dentist, was very kind, very considerate. He answered all my questions. He seemed very professional. He had a nice office, I thought, at that time. And he was black, and he was closer to my ethnicity than the other dentist, who was Jewish. So I said I wanted to be like him.
Okay, so a little bit of positive role model or influence for you.
Yes.
As far as your education or your experience, where did you obtain your education, your credentials, certificates, etc.?
Well, I went to school in Dominican Republic, graduated high school in Dominican Republic, took a year off because I wanted to go into the armed forces. That didn't work. Went back to Dominican Republic, went to school there, and graduated from the School of Dentistry in Dominican Republic. Then I came to New York, the United States, and I got my credentials, went to NYU, and then I did a 2-year general practice residency, Columbia University Harlem Hospital, for my residency.
So a lot of job experience or a lot of credentials involved in getting them.
Well, besides the experience that I gained in the Dominican Republic, a lot of hands-on experience, at the hospital, it was a hospital-based experience. We saw a lot of different cases, a lot of different patients, a lot of emergencies. And I interacted with the oral surgeons, and we had to rotate, do the same things the same departments they had to rotate, but only for a year.
Okay. How would you describe your educational experience? Was there things you liked about it, disliked? What would you change if you had the opportunity to go back?
I liked it. The only thing that I wish I would have changed or I could have changed was my attitude, because the first year I got back into school, I wasn't serious enough. As a consequence, my grades suffered, and I was held back for a year. So the only thing that I would have changed, or I would like to change, was my attitude. I would have taken it seriously from the beginning instead of goofing off.
So it wasn't really much of the coursework or the teachers, just more of how you handled everything.
Yes, in the beginning, I thought some teachers were unreasonable, but now I know that they wanted the students to succeed. They were very strict, and they were just trying to get the best out of their students.
Professionally, how do you describe yourself as an employee and or employer? Your strengths and weaknesses in
I
that sense.
I would like to think that I am fair. I listen to my patients, listen to my staff. I'm always open to improvement, since it's called the practice of medicine, the practice of dentistry. We can't get it right the first time, even though we strive for perfection. And I take to heart the Hippocratic Oath that says, first, do no harm. So we look for the patient's best interest in everything.
Okay. How do you go about improving your strengths and focusing on your weaknesses?
Well, we have in the office, we have monthly meetings. We have every day, we have what's known as a huddle. We go over what the procedures are going to be, the patients that we have to see. I also take continuing education courses every year. I'm part of an organization that requires me to take at least 60 credits, 65 credits every 3 years of continuing education. And since dentistry is constantly evolving, there is new products, new procedures, I have to stay on top of that.
But I'll ask more questions on that later, as we did dig deep into that territory.
Mm-hmm.
As far as like where we are right now, how would you describe your dental philosophy, or what is your dental philosophy? How does oral health contribute to overall health?
Well, your health starts in your mouth. That's my philosophy. If your mouth is not in good condition, then you cannot eat. And if you cannot eat, you cannot nourish yourself. And we have found in dentistry over the last 20 years that there is an oral health connection, meaning that if your teeth are not in shape, if your gums are not in shape, that is a precursor to gum disease is a precursor to heart disease, high blood pressure. We've also found that if you don't have teeth, that also leads to a decreased quality of life. And we've also found that the dentist is the first line of defense in a lot of diseases. When I first got out of school, the AIDS epidemic was a big thing. It was going on, and we were able to, as a dental field, we were able to diagnose